Hello, my name is Alma and I am the pharmacist intern. Um, are you here to pick up a prescription?
Yes, I am.
Well, is this prescription for you or for somebody else?
It's for me.
It's for you? Okay, may I please have your name?
It's Jenny Brown.
Jenny Brown. May I verify your date of birth?
Yeah, it's April 15th, 1965.
Okay. Well, I see that you have three medications here with your prescription. You have metformin, glipizide, and aspirin. Have you taken any of these medications before?
No, I haven't.
You haven't, okay. Well, before I give you your prescription, I would like to give you some important information on how to take your medications. Is that okay with you?
Mm-hmm.
Yes? Okay. Well, we're going to start with your metformin. The brand name for this medication is Glucovage, and the dose that you're going to be taking is 500 milligrams, and you're going to take it twice per day, and this is in the form of a tablet, and you're going to take it orally. You're going to take one in the morning and one in the afternoon, and it's best if you take it with a full glass of water and before your meals. What have you been told to expect from this medication?
Nothing.
Well, this is for your diabetes, and this is expected to decrease your blood sugar levels by decreasing sugar production in your liver. It's going to take a while, so when you once you start seeing its effects, it's going to take like around 6 months. So, yeah, like I said, it's going to take a while. Um, One of the things that I want to mention is that this comes with some common and some severe side effects. Some of the most common side effects is diarrhea, and a severe side effect is that if you start having symptoms of muscle weakness, dizziness, you may want to contact your physician if you start seeing these side effects. Another thing that I want to mention is that you're gonna see the side effects just for 2 or 4 weeks, but they're gonna go away as you continue taking your medication. And just to minimize these side effects, also just take your medication as indicated with your with a full glass of water and before your meals. Um, Also, I want to mention that do not take your drug with alcohol, or also if you using any, if you're doing any imaging using contrast dye, you may notify your physician before you do this. Um, let's see. Another thing that I want to mention is that this has some interactions with alcohol. So if you are on this medication, while you are on this medication, do not take any alcohol. Um, Now we're gonna go to your next medication, which is your glipizide. Glipizide, its brand name is Glucotrol XL, and the dose that you are going to be taking is 2.5 milligrams, and this is a tablet too. You're gonna, but this one you're gonna take it once every day, 30 minutes before your breakfast, and you're also gonna take it with a full glass of water. Um, you're gonna take it. You're gonna swallow the tablet whole, so do not crush it or cut it in half. Just take it whole with a glass of water. What have you been told to expect from this medication?
Nothing.
Well, this is also like metformin. It decreases your blood sugar levels, but this is going to increase your insulin level production, your insulin levels in your body, and in this way, it's gonna decrease blood sugar levels. For this drug, you're gonna start seeing side effects like right away within like 1 or 2 hours after taking the medication. Um, for both drugs, for your metformin and your glipizide, you can monitor for the effectiveness of these drugs, like monitoring your blood sugar levels at home and verifying that your blood sugar levels are within normal. And if they're not, just you may want to verify with let your physician know about this. One of the things that I want to mention with your glipizide is that some of the common side effects for this medication is hypoglycemia. Hypoglycemia is just low blood sugar levels, and some of the side effects for these are like blurred vision, headache, fatigue, and shakiness. So if you start seeing these side effects, you want to let your physician know about this. Um, Also, a more severe side effect for this medication is like intestinal irritation, but you can minimize these side effects if you take your medication as indicated, like taking it 30 minutes before your breakfast every day. Um, Also, another thing that I want to mention, just like your metformin, do not take alcohol, as this may interfere with the efficacy of your drug, of the medication, and also do not take any heart medications, as these also have interactions with your drug. Um, your other drug is your aspirin. Aspirin has several different brand names. Some of the most common are Bayer aspirin or Ecotrin, um, which are some of the most common. For this drug, you're going to be taking 75 milligrams every day, and this is also in the form of a tablet. One thing I want to mention about this one is that you want to take this medication every day at the same time with a full glass of water. And also swallow the tablet whole, do not crush, do not divide the dose. Um, you're going to be taking this medication as primary prevention for cardiovascular disease. So, and it is expected to reduce any risk of blood clots and also reduce the risk of a heart attack. And you're going to start seeing effects right away within an hour or two, just like glipizide. Um, Another thing that I want to say about this medication is that it has common and severe side effects. Common side effects include just nausea and dizziness. And one severe side effect for this medication are ulcers, like GI ulcers. So if you start seeing any signs of like blood stools or abdominal pain, you contact your physician right away. Um, like you can minimize this type of side effects just by taking your medication at the same time every day with a full glass of water. And also, if you are like you have like severe allergy to this medicine, you you're not supposed to take it. Like if you have like severe rash or swollen skin, swollen, do not take this medication. Also, one thing is that this is an NSAID. Do not take NSAIDs with this medication like ibuprofen or naproxen, because this may increase the risk of GI bleed. So when you are on aspirin, do not take any other NSAIDs. Well, as far as the storage, and this is for all three medications, just keep your medications in a dry place, away from light and humidity. And for all three medications, you're gonna take your medication until your physician discontinues its use. So you have 6 refills. So when you start running out of your medication, just come to the pharmacy to get your new refill. Um, for this one, also for all three of them, in case that you miss the dose, just take your missed dose as soon as you remember. But if your missed dose is close to the next one, just skip the dose and continue with your regular schedule, and you don't want to double dose. Um, well, I think that I've been giving you a lot of information on all these three medications, just to make sure that I gave you all of the information correct and you retain the most important things. Um, would you please tell me how many times per day are you going to take your metformin?
Twice a day.
Twice per day, yes. And you're going to take this medication with a full glass of water, right? Actually, all three of them, you're going to take them with a full glass of water. What about your aspirin? How many times are you taking the aspirin?
Once a day.
Yeah, that's right, once per day. Well, I know that I gave you a lot of information for you to take in. I prepare a patient counseling with all of the information that we just went over. So in case that you need you forget anything of the any of the things that we just went over, You can use this as reference, and
Okay.
this is for you to take home.
Okay.
What questions or concerns do you have for me?
I don't have any.
You don't have any questions.
Mhm.
Well, again, in case that you have any questions, my information is on the label of the bottle. Like, here is my phone number and my name.
Okay.
So if you have any questions, just give us a call.
Okay, thank you.
Thanks.